Hello class, and welcome to your Chapter 15 lecture. Today we're going to be discussing over-the-counter, prescription, and herbal drugs. So the learning objectives for today are that by the end, you should be able to outline the general differences between prescription and non-prescription drugs, explain why the FDA occasionally switches prescription drugs to over-the-counter status, describe the potential abuse problems with over-the-counter, prescription, and herbal drugs, discuss the potential problems of making more effective OTC drugs available to the public, describe the type of information that is included on the labels of non-prescription drugs, discuss the rules for safe use of non-prescription drugs, explain why prescription abuse has become so widespread, explain the advantages and disadvantages of generic and proprietary drugs, explain which prescription drugs are most likely to be abused and why, and finally, to discuss the connection between abuse of opioid prescription drugs and management of chronic pain. So let's begin with an introduction. The average cost of brand name, also known as proprietary drugs, has actually tripled in the last 10 years. So insulin costs have increased 600% since 2002. Consumer and legislative efforts are targeting drug companies and policymakers to make drugs more affordable to the public. There are 10,000 different prescription medications currently. Over 30% of US adults will consume at least 5 medications. There's also significant risks that come with prescription drugs, known as adverse drug events, that account for 700,000 visits to ERs and 100,000 hospitalizations. Over 700 OTC drugs were available only by a prescription just 30 years ago. So shifts from prescription to over-the-counter emphasizes the somewhat arbitrary nature of classifying drugs. So one day they're considered a prescription drug and the next day you can receive it over-the-counter. So what is that distinction? So let's look at over-the-counter drugs. Over-the-counter remedies are non-prescription drugs that can be obtained and used without the supervision of a physician or another type of health professional. Over 100,000 over-the-counter products are available today. 60% of the population will routinely self-medicate with OTC drugs. And there are 5 top categories: respiratory, oral care, analgesics, gastrointestinal, and antiperspirants. The potential problems that are associated with over-the-counter drugs include a delay in seeking proper medical care for serious illnesses. So individuals may self-medicate with OTC drugs for too long or self-medicate very serious illnesses that they should be seeking medical attention for. There's also a risk of drug and herbal interactions when it comes to over-the-counter herbal drugs, and even if a person is prescribed a prescription and then supplements that with an OTC drug, you have to be aware of interactions that can occur. There's also an unassessed potential for adverse effects in the user. That person may not know that they're allergic to an additive or something in that over-the-counter drug. And then finally, there is still the potential for abuse, dependence, and misuse of over-the-counter drugs. Let's look at abuse and federal regulations of over-the-counter drugs. So there's a low abuse rate with OTC drugs, with patterns that are different from illegal drugs because they're available on demand, they're perceived as being safe because they're available over the counter without a medical health professional having to prescribe it to you. They're poorly understood by the general public. Again, some of these OTC drugs were available only by a prescription just 30 years ago. Also, abuse of OTC medications can cause structural damage to the body and even death on rare occasions. There is a greater margin of safety for OTC drugs when it's compared to their prescription counterparts. When these drugs are misused, though, physical, psychological dependence can occur. So non-prescription products that can be severely habit-forming include nasal and eye decongestants, as well as laxatives, antihistamines, sleep aids, and antacids. Most states do actually require that cold products that contain amphetamine precursors be safeguarded behind the counter. So you have to ask for those over-the-counter drugs. You can receive them, but you have to ask for them. They're not simply available to just pull off the shelf. Additionally, the FDA is responsible for regulating these over-the-counter drugs through the Center for Drug Evaluation and Research. Reclassifying these drugs from a prescription to over-the-counter has increased due to public demand to be able to access these effective drugs for self-medication and to cut medical costs. We know that prescriptions are very expensive or can be very expensive, and over-the-counter drugs are typically cheaper. The question, though, is will this result in overuse or misuse of more over-the-counter drugs? Will this create a larger epidemic or problem, making these more effective drugs available to individuals over the counter? Another question to consider is, will individuals be tempted to self-medicate rather than go and seek proper medical care? Does this encourage the use of multiple drugs at one time when it's so easy to gain access to multiple types of over-the-counter drugs? And you can take them without a medical professional telling you what you can or can't combine? Does it encourage you to combine those drugs? Maybe you have a cold and you also have some back pain, so you're combining an acetaminophen or an Advil, you're combining that with now a decongestant. And is the likelihood of dangerous interactions then increased? To my last point, you're interacting these different types of drugs, using multiple drugs at one time. Do you now have an increased risk to have an interaction that could be very dangerous to your health? So over-the-counter labels do have to include a few things. One is a statement of identity or a required label that includes the intended action of the drug, a statement of the general pharmacological action or its intended action. What is it there to treat? Is it treating my cold? Is it a decongestant? Is it treating my back pain? Indications for how it should be properly used and directions to properly use it. Do I take one every 4 hours? Do I take two every 6 hours? And then finally, cautions or warnings to those at the greatest risk when taking the medication. So if an individual has a diagnosed medical issue, they should know when reading the label on an over-the-counter drug whether or not it could cause a concern for them by taking that. So we have a few different types of over-the-counter drugs that we're going to cover. We have internal analgesics, upper respiratory medicines, sleep aids, stimulants, diet pills, and skin products. So let's go through those. When we talk about internal analgesics, their therapeutic actions are either analgesic, which, let me back up. An internal analgesic are things such as acetaminophen, salicylates, and ibuprofen. Excessive use, though, of acetaminophen can actually cause permanent and fatal liver damage. So if you've ever heard, if you take too many Tylenol or take it chronically or for too long, you can actually cause liver damage. So we have analgesics. These are going to be those types that relieve mild to moderate somatic pain that's associated with the muscular skeletal structures. They can have an anti-inflammatory action. This means they're going to target inflammation, also such as arthritis. As an antipyretic, this is to reduce the fever, but it's not going to alter normal body temperature. There's also the argument to be careful that a fever may be a defense mechanism by your body that helps to destroy infecting microorganisms. So there's actually no serious problems associated with a fever of 102 degrees Fahrenheit or lower. So it may be better to actually allow your body to have that fever and fight off the infection naturally. Many of these products also contain caffeine or other additives for the stimulant effect to enhance the pain relief. These other additives can include antacids, antihistamines, and even decongestants. Looking now at upper respiratory medicines. So those who are between the ages of 1 and 5 years old are most susceptible to the common cold, and they can average as many as 12 per year. Adults, however, average just 2 to 3 per year, and this decline is the result of immunity that's being built up with time and age in that individual. So you want to be careful not to use over-the-counter drugs too excessively or too much. Again, you want your body to build up that natural immunity. Cold and allergy medications are typically principally formulated with decongestants. So decongestants cause nasal membranes to shrink because of their vasoconstrictive effect. This reduces congestion that's caused by colds and allergies. Sympathomimetic decongestants ingredients are found in cold medicines, and they actually can be easily converted into methamphetamine. So that's why they're sometimes controlled by this Combat Methamphetamine Epidemic Acts of both 2005 and 2010. So what these did was require the keeping of decongestant products behind the counter and also keeping records of those who have purchased these. The concern comes up, however, what if you have 10 children and all of those children end up with a cold at the same time because they're all living in the home together? Should you not be permitted to purchase a certain amount of those types of drugs because you have so many children to treat? We also have to have this concern for congestion rebound, which actually can occur because of tissue dependence, where the nasal membranes will adjust to the effects of the vasoconstrictor in these medications, and the person will become congested even when the drug isn't present. We then have antihistamines, which reduce congestion typically caused by allergies. They have an anticholinergic drying effect or drying action, which can actually lead to a serious coughing response, even dizziness, drowsiness, impaired judgment, constipation, and dry mouth. These drugs are sometimes abused for the psychedelic effects that can occur from very high dose consumptions. They also cover analgesics, which again are to treat pain. So continuing with upper respiratory medications, there are two types of over-the-counter drugs that will treat coughing. So a productive cough is one that actually removes mucus secretions and foreign matter. An unproductive cough is going to be one that's that dry cough that just causes irritation in your throat. So we have antitussives, which will act on the central nervous system to raise the threshold of the cough coordinating center, whereby reducing the frequency and intensity of a cough. The next are expectorants, which increase and thin the fluids of the respiratory tract in an attempt to soothe your irritated respiratory tract membranes and also decrease the thickness of the accumulated secretions so that coughing becomes more productive. You don't want an unproductive cough where you're just irritating the throat. You want it to at least be productive where something is coming up. Cough remedies can also have a psychological value. So they work partly by reducing a patient's anxiety about the cough and cause them to believe that their cough is lessening. So it's possible that they work even more psychologically than they do by their actual action. You're taking the drug, you're thinking, okay, this is going to help my cough, so it does. And there's the potential for abuse of antitussives by teens, which is a significant problem because it can resemble that of PCP. We then move on to sleep aids. So sleep aids actually have no therapeutic value for long-term sleep problems. So people today are actually sleeping 20% less than they did in the early 20th century. The loss of sleep in America is typically the result of stress and anxiety, and some forms of insomnia can actually have a genetic basis. So it may not just be your stress from daily life, it could be a genetic issue. And this can produce unpredictable and dangerous behavior, specifically in young children when they don't get the sleep they need. Have you ever seen a child that did not have a nap? Their behavior can be pretty unpredictable and sometimes dangerous if they're tired enough. So, because sleep aids are not really therapeutic for long-term problems, we recommend that counseling and psychotherapy are used because they're more effective than sleep aids. Tolerance can also build within 4 days. So again, there's a placebo effect to these drugs that is actually more beneficial than its pharmacological effect. In low doses, sedation and anti-anxiety action will occur. And melatonin is a natural sleep aid. It's been called the all-natural nightcap of the 1990s. It's also been shown to slow the aging process, and it stimulates the immune system and also enhances sex drive. So it's a naturally occurring hormone, and it's also found in some foods, but you can also find it as an over-the-counter drug. This dietary supplement is not regulated by the FDA though, so keep that in mind. Moving on to stimulants. Stimulants contain high doses of caffeine. They will increase your state of alertness during periods of drowsiness, and moderate doses have been shown to actually be able to help test scores, but excessive caffeine can do the opposite, causing anxiety and a significant impairment in memory. Withdrawal typically results when this drug is stopped. So when we look at sympathomimetics, this is a mild over-the-counter sympathomimetics. Principal ingredients are phenylphrine and caffeine. These can have physical complications though, such as anxiety, restlessness, headaches, breathing problems, and tachycardia, which is just a rapid heartbeat. They are marked as a safe alternative to illegal stimulants, but in high doses, they can still cause physical complications. Gastrointestinal medications are another type of stimulant. These are used to treat issues related to the esophagus, your stomach, and your intestines. We have antacids and anti-heartburn medication. So these drugs can treat indigestion, which would be antacids, heartburn through gastric secretion blockers, constipation through laxatives, and diarrhea through antidiarrheal medications. Over-the-counter medications for heartburn and indigestion caused by excessive eating or drinking are typically used, and these can provide long-term treatment of chronic peptic ulcer disease. Gastritis is actually inflammation or irritation of the gut specifically. This has also often been referred to as acid indigestion, heartburn, upset stomach, and sour or acid stomach. So antacids can help here to inhibit the absorption of some vitamins and minerals, including calcium and iron. Moving on now to diet aids. So diet aids work by depressing the appetite. Obesity has actually been linked to medical problems such as cardiovascular disease, some cancers, diabetes, chronic fatigue, and aches and pains, as well as psychological disorders and depression. So over-the-counter diet pills are actually minimally effective. They tend to contain high doses of caffeine, sometimes some natural ingredients that may have a mild sympathomimetic action. Anorexiants are going to be the most effective types of diet aids. Moving on to skin products. So skin products can include acne medications, and acne medications can focus on sebum removal, which would be in the form of alcohol wipes that would remove all of the oil and fatty chemicals that can accumulate on the skin and tend to plug the glands and hair follicles. You then have peeling agents, which are to prevent acne eruptions by causing the keratin layer of the skin to peel or by killing the bacteria that causes the inflammation that's associated with acne. Sun products are another type of skin product. So these help to prevent premature aging, skin cancer, and skin damage. Protective sunscreen products are designated by a sun protection factor or SPF number. So SPF actually tells the relative length of time that a person can stay in the sun before they'll burn. So an example is that SPF 10 allows a person to remain in the sun without burning 10 times longer than they would without that sunblock protection. Additionally, there's natural pigments that are found in the skin that can provide some UV protection, though those of us with fairer complexions, myself included, have less pigment to protect us from the sun, so we tend to use SPF such as 50 and 70, for example. We then have skin first aid products. So these can come in the form of local anesthetics, which are going to simply relieve discomfort and pains from burns or trauma. Antibiotics and antiseptics can treat or prevent skin infections when you have a cut or a burn. And then antihistamines, they're going to relieve that itching and inflammation that are associated with either skin rashes, allergies, or even insect bites. Moving on to over-the-counter herbal natural products. So 80% of people worldwide use herbal products as part of their primary health care. Currently, there is little to no regulation on these herbal products. They can be used to treat anxiety, mild to moderate depression, chronic fatigue, arthritis. They may claim to alleviate digestive problems or even elevate your mood. However, there is no evidence that they actually elevate a normal, undisturbed mood, or that they are particularly effective against severe mood disturbances. So if you're feeling fine that day, nothing's wrong, they're not really going to do a whole lot. Or if you are diagnosed with a severe mood disturbance, they're going to have very little effect. There's also the risk with these that some people may try to self-treat severe depression or emotional instability. Additionally, there's the concern that these herbal products are going to interact unwell with regular over-the-counter drugs and prescription medications. So things such as St. John's wort, kava plant, which we've previously talked about, and echinacea can actually alter the metabolism of other drugs that are used to treat heart failure, asthma, infections, blood clots, and cancer. So you have to be very careful taking these herbal natural products. While they're natural, that's great, but they still may not interact well with other prescription or over-the-counter medications that you're on. The Dietary Supplement Health and Education Act of 1994 actually requires that the government demonstrate substances and herbal products are harmful before they can remove them from the market. These products cannot use terms such as diagnose, treat, prevent, or cure to describe their herbal products, however. So you can't claim to diagnose depression. You can't claim to treat depression. You can simply say that it should elevate mood. So it makes the manufacturer responsible for the product's safety. It also explains how the product literature is used for product promotion. Again, can't use those certain terms. And this act describes what can be included on those herbal natural product labels. Some of these are actually being included in food because there's a lack of regulation on them and a lackadaisical attitude from the public regarding natural products. So an example of foods are ginseng and ginger ale. There's kava corn chips that are available, and even putting echinacea in fruit drinks. So serious side effects or abuse can still result from these natural herbal products. As a general rule, If a substance elevates your mood, causes a feeling of energy, or brings on a feeling of relaxation and relief from stress, then it likely has the potential for abuse. So while serious side effects and abuse can result, they don't occur very frequently, and typically they're relatively easy to treat if it does result. We'll now move on to prescription drugs. So we have a number of common categories of prescription drugs that we're going to work through here. We have analgesics, antibiotics, antidepressants, anti-diabetic drugs, anti-ulcer drugs, bronchodilators, cardiovascular drugs, hormone-related, sedative hypnotic agents, stimulants, and those that are used to treat HIV. So let's start by talking about prescription drugs. The US leads the world in prescription drug consumption. The Durham-Humphrey Amendment of 1951 established criteria to determine whether a drug should be used only under the direction of a licensed health professional, so by a prescription, and said that drugs are controlled with a prescription if they are habit-forming, not safe for self-medication, intended to treat ailments that require the supervision of a health professional, or are new and without established safe track record. So 70% of US adults who are between the ages of 40 and 79 have used at least one prescription drug in the last 30 days, according to one study. That same study also showed that 20% of those adults were concurrently using 5 or more prescription drugs. Uncontrolled factors are what make prescription drugs unaffordable. So there are possible strategies to combat this issue that includes making it easier for cheaper generic drugs to get onto the market, including drug prices in their ads to better inform the consumers of how much they may cost. So you may see an ad for a prescription drug, think, ooh, I need to talk to my doctor about that next time I'm in. Come to find out the drug costs $300 even with your insurance. Allowing the government to negotiate with drug companies for lower prices, so there's not monopolies on these. Allow Americans to receive cheaper drugs from other countries. Your book also talks about increasing taxes on drug companies whose prices are set unreasonably high, and ending tax breaks that are given to drug companies for their advertising expenses. These are all ways that could possibly lower the cost of prescription drugs that are making them unaffordable for some of the population. So OxyContin and Vicodin are the most commonly abused prescription drugs. There are over 130 opioid overdose deaths in the United States every day. So the classes of prescription drugs that are most likely to be abused include narcotic analgesics, CNS depressants, and stimulants. So those who abuse OxyContin and Vicodin, which are those narcotics, 13% will abuse them for recreational use, 39% will self-medicate a pre-existing medical or emotional problem, 48% will do it for both of these reasons. And then some of them, it's simply just part of a larger substance abuse problem that they have, including a number of other drugs that they take. Young people, unfortunately, can obtain these prescription drugs from medicine cabinets and web pharmacies. So farm parties are described as high school students who get together and will just simply try to get high on a mixture of different prescription drugs, followed by a chaser of alcohol. There have been tight restrictions from third parties, such as insurance companies, in an attempt to lessen the amount of narcotics that are being prescribed. Also, there are some doctors who will actually write prescriptions for money on the side, which is illegal, by the way. And then drug-seeking behaviors to watch out for those who may be abusing prescription drugs includes the use of altered or forged prescriptions, claims that a prescription has been lost. The person may have frequent visits to emergency rooms or clinics for poorly defined health problems. They may not be able to articulate exactly what's wrong. visits made to the pharmacy very late in the day or on weekends or just before closing, alteration of doses on a legitimate prescription. So you may be prescribed OxyContin 10 milligrams 1 every 12 hours, but you're taking 3 every 12 hours. Loud, abusive, or insulting behavior, using several names, and being very knowledgeable about drugs. Additionally, there are 22,000 babies born per year that are physically dependent on prescription analgesics. These babies will typically remain in the hospital for weeks so that they can withdraw properly. They may experience vomiting with diarrhea, extreme irritability and shaking, an inability to sleep, trouble eating, and even frequent shrieking from the pain that they're in because they're withdrawing from the drug that the mother was taking. So, what is necessary information that healthcare providers need to have to make sure that we're not having individuals abusing these prescription drugs? So, doctor-patient communication must be reciprocal. The patient must talk and the doctor must talk. So, the doctor is going to need a complete medical and drug history for that individual. They need to know about drugs that are routinely being used. And we've also had an establishment of databases in some states to include up-to-date information on the prescription drug history of a patient so they can monitor for abuse and ensure drug interactions won't occur. Health professionals do have a legal and professional obligation to communicate how to use a prescription drug properly to the patient according to the Omnibus Budget Reconciliation Act of 1990. They must be able to tell the patient the condition that the drug is treating, the desired outcome using this prescription, possible side effects it could have, how to properly administer the prescription, and proper disposal. So looking at drug selection, we have generic versus proprietary. Generic is simply going to refer to the common name of a drug that is not subject to trademark rights, while proprietary denotes medications that are marketed under specific brand names. So doctors can prescribe either the generic or the proprietary version. Generic drugs will be cheaper though, because the pharmaceutical company that's marketing that drug did not invest their money into the discovery or development of it, so they can charge less. Due to FDA regulations, the quality of the generic drug is the same and can often be substituted for proprietary products without compromising the person's therapy. So we have either positive laws and negative laws in states. Pennsylvania is a positive state. So positive laws actually require the pharmacist to substitute generic products unless the physician gives a specific instruction not to do so. So if you've ever been called in a script, you go to the pharmacy and they hand you something that doesn't look the same or has a different name than what you were maybe expecting, because you're used to hearing the proprietary names of things, not the generic name. And the negative laws then are those that actually some states forbid substitution by pharmacies without the explicit permission of the physician. So let's start by going into analgesics. So we have narcotics. Narcotic types typically dispensed by a prescription are going to include codeine and hydrocodone, moderate potency agents, high potency morphine, and narcotic analgesics are often combined with aspirin or acetaminophen to enhance the pain relieving actions. So all narcotic analgesics are scheduled due to their potential for abuse. Narcotics are also most likely to be abused due to the severe dependence that develops from taking these drugs. NSAIDs are non-steroidal anti-inflammatory drugs. These are used to relieve inflammatory conditions, and they can have adverse side effects such as stomach irritation, kidney damage, tinnitus, which is ringing in the ears, and swelling from fluid retention. The pharmacology is similar to the over-the-counter compound of ibuprofen, and there's no abuse potential for these, and they are unscheduled. Looking now at antibiotics, they're described as antibacterials. These antibacterials are effective in treating infections that are caused by bacteria or microorganisms. And these drugs can differ in whether they are bactericidal or bacteriostatic. Bactericidal will kill the bacteria. Bacteriostatic will actually stop the growth of the bacteria. The species of the bacteria sensitive to their antibacterial action. So it depends on what the species is and what antibacterial will be prescribed. You can have either broad spectrum or narrow spectrum types. Broad spectrum are going to be effective against many different species, and narrow spectrum is the opposite. They're going to be very selective and effective against only a few species of bacteria. 5 to 10% of the population are actually allergic to penicillin type antibiotics, myself being one of them. I was informed by my mother at a very young age. You ever been told by your parent when you start going to the doctor, as you start getting older by yourself, make sure you tell them this is what you're allergic to. Make sure you know what you're allergic to so they don't prescribe you something that could harm you. So it's interesting that this amount of the population is allergic to penicillin type antibiotics. We then go into antidepressants. So severe depression is what antidepressants treat. And severe depression is the most common psychiatric disorder that affects 6 to 7% of the population at any one time. Severe depression is characterized by a diminished interest or pleasure in normal activities, accompanied by feelings of fatigue, pessimism, and guilt, as well as sleep and appetite disturbances, and sometimes suicidal desires. There are 4 major types of depression. You have endogenous major depression, which occurs spontaneously and results from a transmitter imbalance in the brain. You then have depression that's associated with bipolar mood disorder. So this is also known as manic depressive disorder. You can have drug-induced depression, which is simply associated with the ingestion, injection, or inhalation of a substance. And finally, we have the most common form, which is reactive depression. This is the response to situations of grief, personal loss, and other highly stressful situations. So it's your body's way of reacting to those. There are 3 categories of antidepressants that will treat depression. The first is tricyclic antidepressants. These can cause drowsiness, dry mouth, blurred vision, and constipation because of their anticholinergic activity. We then have monoamine oxidase inhibitors, or MAOIs, which are less popular with clinicians and can have deadly interactions with many stimulants of abuse. So number 1 here was your first category of antidepressants that came out, but then we realized they started having all these adverse side effects, so we had MAOIs. Now we have drugs such as Prozac, Zoloft, Paxil. You may be familiar with some of these names that are actually have been found to be safer and have fewer side effects. So they're prescribed more often. Anti-diabetic drugs. So diabetes mellitus actually affects approximately 29 million people in the United States. Untreated diabetics can have severe problems with cellular or systematic metabolism and elevated blood sugar. Elevated blood sugar has also been called hyperglycemia. You can have either type 1 or type 2 diabetes. So type 1 is caused by total destruction of the insulin-producing cells that are found in the pancreas, and this usually begins in juveniles, or when an individual is in the age of a juvenile. This can be treated with subcutaneous injections of insulin. About 1 to 3 times per day they're typically needed. Type 2 diabetes then is the adult onset diabetes that typically occurs after the age of 40 and is frequently associated with obesity. Type 2 diabetes can subside with a proper diet weight management, and even exercise. When that doesn't work, we can use oral hypoglycemics, which are taken by the mouth and lower the blood sugar by stimulating the release of additional insulin from the pancreas. Unfortunately, cardiovascular disease can be increased by some anti-diabetic medications. Additionally, so when diet, weight management, and exercise don't work, we try hypoglycemics. When they don't work, then we switch to injections. Anti-diabetics are then meant to simply restore the proper insulin function of the body and of the pancreas. Looking at anti-ulcer drugs are going to treat peptic ulcers, which are sores that recur in the lining of the lower stomach, or most often in the upper portion of the small intestines. They do this by relieving acute discomfort, by neutralizing gastric acidity through selectively blocking the activity of gastric histamines, which will reduce the secretions of gastric acids and digestive enzymes. These gastric acids and digestive enzymes are involved in the creation of peptic ulcers, but the exact cause of them are not fully understood. So it is believed that the bacteria Helicobacter pylori plays a role in the creation of these peptic ulcers. Most patients will be treated with antibiotics to eliminate these bacteria. So these drugs will selectively block the activity of the gastric histamine, also called H2 blockers, that substantially reduces that secretion of gastric acids and digestive enzymes, so that peptic ulcers don't form. We then have the category of bronchodilators. So these bronchodilators are useful in relieving respiratory difficulty that's associated with asthma. So bronchodilators are drugs that will widen the air passages, facilitating breathing in patients with air passage constrictions or obstructions. Asthma is defined as an intense coughing. You can have shortness of breath, a tightness in your chest, and wheezing that can actually be life-threatening if it's not treated properly. So bronchodilators, again, are going to relax those muscles of the air passages so that breathing can be facilitated. There are two categories, including sympathomimetics. So you have beta adrenergic stimulants, which are drugs that stimulate a subtype of adrenaline and non-adrenaline receptors. You also have xanthines, which are just simply caffeine-like. These bronchodilators should not be used by patients with cardiovascular disease, and they also may dangerously interact with sympathomimetic stimulants. Cardiovascular drugs. So cardiovascular disease is a leading cause of death in the United States, and it's been for the past several decades. So these drugs are going to treat hypertension. So you have antihypertensive agents. 29% of US adults have hypertension, which is persistent high blood pressure. This can actually result in damage to the heart, kidneys, and brain if it is not treated. So diuretics can be used, and these are going to lower the blood pressure by eliminating sodium and excess water from the body. Direct vasodilators are going to reduce blood pressure by relaxing the muscles in the wall of your blood vessels that cause vasoconstriction, so the blood vessels can dilate and decrease their resistance to the blood flowing naturally. You can also have anti-anginal agents. So you can have angina pectoris can result from continued ischemia. And this is simply a condition where the heart is being deprived of sufficient blood flow, so the oxygen requirement of the cardiac muscles are not being met, and the breakdown of chemicals caused by continual activity of the heart results in a pain known as angina pectoris. The most frequent cause of this obstruction of the coronary vessels, and heart attack can even result. So these drugs will decrease the oxygen deficit of the heart by decreasing the amount of work that's required for the heart to function normally, or by increasing the blood supply to the heart. These cardiovascular drugs will also treat CHF, or congestive heart failure. So treatment includes improving the heart's efficiency through drugs that will cause vasodilation. So when the cardiac muscle is unable to pump sufficient blood to satisfy the oxygen needs of the body, congestive heart failure occurs. This can cause an enlarged heart, decreased ability to exercise, shortness of breath, and an accumulation of fluid, known as edema, in the lungs and limbs. We then have cholesterol and lipid-lowering drugs. So cholesterol and some types of fatty lipid molecules can actually accumulate in the walls of the arteries and narrow the openings of these blood vessels, which causes hypertension, heart attacks, strokes, and even heart failure. So when lifestyle changes are insufficient, cholesterol-lowering drugs may be used to prevent the damage that changes in the blood vessel walls can cause. We then have hormone-related drugs. So hormones are released from the endocrine glands and are important in regulating our metabolism, growth, tissue repair, reproduction, and other vital functions. These body functions can be impaired, causing abnormal growth, an imbalance in metabolism, disease, and often death. So these drugs will treat deficiencies or an excess of hormones that can impair the body's function, such as to treat diabetes, using insulin to treat diabetes, using artificial thyroid hormones to treat hypothyroidism, which is simply an insufficient activity of the thyroid gland. Conjugated estrogens can be used to relieve symptoms of menopause that result from estrogen deficiencies. And they can also be used as contraceptives or corticosteroids. So contraceptives are those containing the female hormone estrogen and progesterone and alters the female reproductive cycles to prevent pregnancy. Corticosteroids then suppress the immune system, and high doses can reduce inflammation and even treat severe inflammatory diseases such as arthritis. We also have sedative hypnotic agents. 12.5% of US adults will use these agents every year. 2% use them daily. So these includes your sleeping medications that, if they're used in excess for reducing things such as stress or aiding in sleep, can actually lead to addictions and adverse consequences. Stimulants. Stimulants are used most commonly to treat ADHD, to improve the attention of the person while also controlling impulsivity and disruptive behaviors. ADHD is the most common mental health problem in children, and it affects approximately 10% of all school-age children, most of them being males. Additionally, non-stimulants and antidepressants have also been used to treat ADHD. There is a positive correlation between the rise in ADHD medication use and an increase in stimulant use without prescriptions. So by prescribing all of these children ADHD medications, we're now seeing an increase in stimulant use of individuals across the board without a prescription. So I can tell you, being in juvenile probation, families can actually receive a stipend from the government when their child is diagnosed with ADHD. For that reason, occasionally, you will have parents that insist a child be diagnosed with this disorder simply to receive that stipend. I'm not saying that happens all the time, but there is that out there, and we have heard it from some parents. There's also been a concern lately that we're overdiagnosing children with ADHD for behavioral issues or behaviors that seem like issues that are simply normal childhood actions, but some parents, and understandably, have very busy lives, very stressful schedules, and it's tough to deal with a child that's acting out. So sometimes it's much easier to place them on a medication than it would be to try behavior modifications that require a lot more time, energy from the parent. College students may also abuse these short-acting stimulants to either enhance their performance while studying, or while they're partying, or even sometimes they're used to lose weight. Finally, we're going to talk about drugs to treat HIV. So drugs to treat HIV. HIV is a human immunodeficiency virus which attacks the body's immune system. There is currently no cure, but it is treatable. So it has a delayed onset and slow progression of the infection. There are a few types of drugs that treat HIV. So we have transcriptase inhibitors, which actually block a unique enzyme that's essential for HIV's replication. You also have protease inhibitors, which prevent HIV from maturing. It's particularly effective when it's used in combination with a transcriptase inhibitor drug. So when you combine these two together, it has very good effects. Treatment can actually be over 80% effective in suppressing the symptoms of HIV and in preventing death. We'll also talk about HIV in this population more in a later chapter. What are some common principles for using drugs safely and effectively then? The most effective way to teach people not to use drugs improperly is simply to help them understand how to use the drugs correctly. So once people can appreciate the difference between benefits of therapeutic drug use and the negative consequences that result from misuse and abuse, they're then going to be more likely to use that medication cautiously and in a thoughtful manner. Patients should be able to answer the following questions. Why am I using this drug? How should I administer the drug? What are this drug's active ingredients? What are some of the side effects that I can expect from this drug? How long should it be taken? And once I'm done taking it, how should the drug be disposed of properly? So there's been an escalation of prescription misuse, which is the result of excessive unused medications being disposed of either improperly or just simply readily available to those who can abuse them. A major factor in this escalation, includes improper destruction or improper disposal of the drug. So you should not flush drugs. You should store them in secure places because many are in very high demand and are tempting to young people. You should not dispose of prescription bottles that contain your personal information. It may be easy then for an individual who abuses prescription drugs to attempt to take that information on the bottle and steal your identity to go procure the same drug. You should place unused prescriptions in a plastic bag with moist coffee grounds instead, or cat litter that actually helps to dissolve the pills. And you can place these drugs in secure drop-off boxes that are usually at various locations around your town. I know this was a long lecture, so I appreciate you bearing with me and still being here. So let's sum this all up. Prescription drugs are only available through authorization of a health professional, while non-prescription over-the-counter drugs are available without a prescription. Over-the-counter drugs are safer, have a lower abuse potential, and are less effective than prescription drugs. The FDA occasionally switches prescription drugs to over-the-counter status in an effort to make more effective medications available to the public on a non-prescription basis. Prescription drugs have a higher abuse potential than OTC drugs, but over-the-counter drugs still have the potential for abuse if they are used improperly or they're overused. Herbal drugs are not regulated by the FDA, which makes it difficult to assess their abuse potential. However, as a general rule, If any substance elevates your mood, it should be assumed that there is a potential for abuse. Making more effective over-the-counter drugs available to the public can lead to overuse and inappropriate use, leading to dependence and negative side effects. Labels of non-prescription drugs must include the following: the active ingredients and their quantities, instructions for safe and effective use, as well as cautions and warnings. Rules for safe use of non-prescription drugs include following proper instructions on the label, seeking medical professional help for serious or persistent conditions that are not being treated or controlled with over-the-counter medications, talking to a pharmacist or doctor about possible drug interactions. Prescription abuse has become so widespread due to the excessive unused medications being disposed of improperly or being readily available to those who abuse them. Generic drugs have the same quality as proprietary or brand name drugs, but they are often much cheaper because the manufacturer did not invest in the research and development of that drug. So they're able to make it available to the public at a cheaper cost. Narcotic analgesics, CNS depressants, and stimulants are most often abused for recreational purposes or self-medicating a pre-existing physical or mental condition. And finally, prescription opioid drug use can start as treatment for an injury or surgery, but sometimes that quickly leads to abuse for management of chronic pain. Appreciate you all hanging tight with me through that very long lecture. If you have any questions, feel free to reach out. But that was your Chapter 15 lecture on over-the-counter prescription and herbal drugs. Have a fabulous week.